Today on the podcast, we have Dr. Burr from Utah, and we spoke about his entire career journey from being a medical assistant to a doctor to then being a doctor and a clinic owner. It's a great journey, great American success story, and I hope you enjoy. What's your journey to where you got to today from like medical school, graduating, and then going into the business?
Okay, yeah. So yeah, I went to Brigham Young University here in Utah. I've been interested in medicine since I was in high school. I fractured my arm really bad when I was playing football, and then I remember having my pins in my arms and screws and all this kind of stuff. And I thought, well, that's pretty fascinating. And then I thought, oh, my medicine would be actually be a fun career. So I initially wanted to be an orthopedic surgeon. I realized how wrong that was as I got further along in my career. And then while I was at BYU, I worked as a medical assistant in dermatology for 4 years, and so I got a good feel of the field of medicine. And then always planning on going to medical school. And then when I went to medical school, I said I'm going to blaze my own trail. I'm going to pick some other career that has nothing to do with dermatology, just to be different. But then as I was in medical school in Oregon, as I got familiar with other fields, it just came back to me like derm is just the best. It really is. And then so yeah, I pursued that, wrote some articles in it, got into residency in it here in Utah, and then went full circle and started working at the same clinic that I was a medical assistant in, years prior, and then took over the practice about 3 years after starting. After the doctor who'd been working it forever had decided to retire.
And that's the craziest part of the story is that you took over the practice. And I love a good like American Utah success story. So
Yeah.
tell me about that.
I mean, I'm a small town kid and I don't know, like I always felt like I don't know how you feel in life, but sometimes I'm just like I never feel like I'm adequate. I never feel like I'm good enough at I mean, it's just probably just my own insecurities or whatever, but I've always tried my hardest to get where I wanted to be, and even despite being worried that I may not be good enough in things. And so I worked as hard as I possibly could when I was at BYU while working about 20 or 30 hours a week in dermatology, got accepted into medical school, and then I see all these people around me who are just flat out geniuses who just don't even have to study and they just know everything. And trying to hold my own with those people, it's intimidating, but I just tried as hard as I could, and then just kept with it and had some ups and downs. Sometimes the downs were really painful, but just stuck with my plan and uh, worked and worked and worked, and then got into dermatology, and then not to like toot my horn or whatever, but I think I have a pretty relatable personality to people who are either in authority or even with my
Mhm.
patients, that like I'm a pretty easygoing person that providers are like, hey, I like this guy. I can see something with him. And so the doctor who I had worked with as a medical assistant who just saw me as just a little at the time $15 an hour medical assistant, like there's something with him that I could see him not only joining me as a partner, but then eventually replacing me to take on my position that I have set up and ran how I wanted for 30 years, and he can continue my legacy. So just a lot of hard work despite some serious setbacks of tough times, but I didn't give up, and I'm happy that I didn't because I'm very blessed.
Are there any tough times to be comfortable talking about or
Oh, let's see here. Trying to think off the top of my head, like I remember in medical school, my first year, we start with anatomy. Anatomy is just like throwing in the deep end of the pool and just survive, and everyone just kind of works their way through it. But I remember the very first course we took after that was immunology, and it was just weird stuff to me. I mean, I learned the basics of it in college, but very basic to what we were thrown at medical school. And I remember my very first, or sorry, my second exam in that class that I just got rocked by this exam, and I just thought, this for me? Is this the right career? People told me if you're gonna back out fast because
yeah.
before you get hundreds of $1,000s in debt, that's not going to go away if you back out as a fourth year. So I remember thinking like, gosh, if this is just the second course exam and I already got rocked, what's the point in getting rocked for 4 years and then have this massive debt that I can't pay off anyway because I won't. And so I decided is this really for me? And so I had to talk with my wife about it, and then I decided to stick with it. Like maybe it was just a setback, and then and pursue and keep going. And it got a little better. I got a little more comfortable with what I was doing, and then it all seemed to work out. But I remember that exam because I hadn't been rocked like that in an exam in college or high school or anything like that. It was the first time I had felt that, and it really will humble you. And I was seriously wondering if this was the right choice for me, but I'm glad I stuck with it.
I had something very similar. I had a very easy high school I went to, and then when I went to
Hmm.
college, I was like, oof, this is like the reality. Um,
Yeah.
I know I've spoken to a lot of doctors who are younger doctors, and
Hmm.
they go into the hospital system and they're really, really not satisfied, and they really want to be in a position where you are, where you run the clinic, you can deliver medicine how you want to deliver it.
Hmm.
Do you have any advice for doctors who are maybe not satisfied with their current positions in a hospital?
Yeah, I mean, off the top of my head, I mean, the thing is I would say just do what's best for you. It's your life. It's not the hospital's life that they're dictating how you live your life. And sometimes with medicine, I think we feel like we're just trapped where we are, that like we can't do anything different than what we signed up for. And and I would say to those people, do what's best for you. If working where it is, where you are is the best place for you, then do it. If you're not happy with what you're doing, it's your life and don't let them ruin it. And so, I mean, that's there's a reason why I don't work in the hospital. So I mean, that's my best advice is I like the hospital setting. I like the stuff that you're doing in a hospital because you're truly saving lives. But for me, it like just the 10,000 protocols, just it's no one managed anything. You just refer everyone to everyone else, and someone else has to fix the problem. It just wasn't for me, and so, yeah, I would just say, just if it's not for you, then don't let someone tell you how to live your life. Do what's best for you.
Yeah, and your patients or
And
future
your patients,
patients.
absolutely, yeah, yeah.
What are kind of the best things about running your own dermatology clinic versus some other, like sort of the pros and cons, the highs and lows of it? Would you say?
That's a great question. The pros, I can establish a clinic that can be ran how I want it to be ran. Um, Something that's really important to me is people coming into the clinic with a question or a problem, and they leave with the resolution or an answer, right? To why what they came in with an issue, and they leave walking out of our front door saying, I see why we're doing what we're doing, and they have motivation to pick up that prescription or go through this procedure, whatever it might be, because they can understand the why. And since it is my clinic, I can teach this to my physician's assistants, to my staff. And so that can be passed on. And I see it in my staff. And people come up to me and say, hey, your staff is just incredible. They teach us well. They're so super friendly. And that's part of, I can't take credit for that. That's part of it, just the people that they are. But it's something that we've set up in our own practice, in my practice, that I love how that flows. That we just don't, people don't walk in the clinic and then just get something, but not without understanding why. And that starts with me and it goes through every single employee underneath me. And so I love that. One something that's great also is that like I can sit here on a Thursday at 1:20 and have this conversation with you. I can pick my schedule, which works best for me. My son had a soccer game yesterday at 3:30 in the afternoon that I wanted to go to, so I moved the surgery during lunch so that way I could go get it done. And so when it's my clinic, I can have control over that, and I absolutely love it because I love being a doctor, but I also love the other aspects of my life that I love that I can manage that. Some of the downsides to it is it's all on you. When times are tough, if financially things aren't going well, then it's like, well, then it's on you. It's and it's a lot of pressure on that regard. If someone is upset because of something that happened that I wasn't even involved with, that I didn't even like, I could have been on a vacation with my wife and something happened with communication with the physician assistant or literally just a
Mm,
front desk person. Ultimately, it all falls back on me as a private business owner, and so that's sometimes a ton of pressure. I've had a lot of sleepless nights over stuff like that. The things I haven't even been like I didn't even meet the person, and so it has a ton of pressure in that regard. But the pros of it are, in my opinion, outweigh those cons, that I'm willing to deal with those occasional stressors of and upset someone or financial tough times, but the pros definitely outweigh it. That if I unless unless life changes, I have no plan on changing what I'm doing.
I saw a really funny viral video of this
Hmm.
dermatologist who his staff played a prank on him. They pretended they were on the phone with the patient and they were being
Hmm.
like incredibly rude. And he's there, like, what are you doing? And he actually grabbed the phone. He's like, I'm so sorry. And then he realized it was just nothing. He's like,
Yeah.
oh yeah, it's hilarious. That kind of human touch of a close knit group. Um, so you kind of mentioned about the lows. What was COVID like at the clinic? I don't know if you were the owner during COVID. It sounded like you were still.
I wasn't yet. So I started in 2019, and then so the doctor who I was working with, he had cut back significantly by that point. He was barely working. I shouldn't say barely. He's working, I don't know, 15 to 20 hours a week because he had his own health issues. He was 70, whatever he was, 76. And so I wasn't the owner of the practice, but I was like the doctor who was there all the time. And it was not fun. It was incredibly stressful financially because dermatology is a field that, for the most part, people have to walk in the door because we do so many procedures with warts and moles and skin cancers and cysts and all that kind of stuff, and you can't take care of those over a computer screen, right? And it's you can't really evaluate people's skin that well through a virtual encounter. Yeah, you can get an idea, but it's much better to look at it face to face. So the virtual world really had its limitations because we were instructed that only people who had cancers could only come in, people who had terrible rashes, but you're just your run-of-the-mill wart patient, they couldn't come. And so you just saw the patient totals just go way down because I mean, we were all lost our minds for a little while and then we didn't know what we were supposed to do, right? So it was tough financially. I remember I got COVID myself and I had to take 2 weeks off of
Mm.
work and I didn't get paid for a while. And so like it was brutal. My office manager was wondering if our practice was even going to survive. And so
Oh, really?
yeah,
Was that bad?
that's one of these situations where, as a private business owner, those are some of the times you have to be willing to endure because there's no hospital or big group that you can fall back on. Another thing was something similar was in 2024. Did you hear about this issue with like Change Healthcare, where this Russian cyber gang took over Change Healthcare, which is one of the clearinghouses that you use for insurance billing and all this kind of stuff?
No, I've
I don't know
never
if you
heard
heard
of
about it.
that.
It was nuts. And so Change Healthcare, I believe is what it's called, is one of these clearinghouses that we use for billing insurances. And we don't know which one you're assigned to. It's just whatever your practice manager is with. Well, anyway, a Russian cyber gang hacked into their system, and I can't remember how much data they stole, but it was like terabytes of data that they stole, and they basically held him for ransom and said, unless you give us, I can't remember, what it was like 20 million in Bitcoin, we're not going to give you this patient data back. And so they had to shut the whole system down. And so we didn't get insurance payments from January of 2024 till like March. And as a business owner, like I had to just sit on paychecks for like 8 weeks and because there was just no money and I had to pay for the lights and the building and the staff and all that kind of stuff. And so those were some of those times it was just like, what have I done? Pick my own business. And just like COVID, and that's the trade-off of being a private business owner is when those times happen, you have no one to fall back on, and it's just on you to dig deep and get through it.
Well, it's a good point because as well you mentioned like the sort of medical school being expensive as well. Like with all the risk, the medical debt, like I think running your own practice is huge liability to it in a
Right.
way. Yeah.
Yeah, and so that's the thing. And your pay is like you eat what you kill,
Yeah.
and as a private business owner, and if I take off work, it's just I don't like my just I don't have some just standard salary that I get my X number of days off that the paycheck just always comes. If there's no money coming in, then it's on me to, because I don't it's not my staff's fault if I'm not there. It's my fault. And so those are some of the things that I have to be willing to endure as a private business owner.
Yeah. So another thing I wanted to ask you, I kind of mentioned this to you just when we were chatting a little bit before the call, is that there are so many private clinics now that are getting bought up by MSOs and funds and
Mhm.
stuff. And it's like, what's your kind of thoughts on that? If I came to you right now with a check and said, hey, I want the clinic to be run by me, would you be interested in that offer or no?
I mean, you put enough commas in there, maybe I would. But uh, at this stage of my career, I have zero interest in doing that. I'm
That's
40 years
awesome.
old. I'm 7 years outside of my residency. I'm planning on doing this for another, 25-ish years. And I mean, you move the clock forward 15, 20 years from now, and I'm in a different stage of my career, and maybe I'm just kind of maybe a little burnt out from the management of a clinic. But for right now, I have lots of energy. I love being able to run a clinic how I want it to be ran. And we're not perfect by any means, but we have great feedback from our patients based on the system that we have going on here. And I have zero desire to make a switch because I do think the care that we're providing is, I'm not saying anyone else the way they do it is wrong, but our system works well. And if it does work well, I think there's ways you can improve around the edges, but not necessarily tear up your whole foundation and start all over again.
Yeah. So another question I wanted to ask you, you kind of mentioned briefly with insurance hacking and stuff. I always like to ask doctors what they think about insurance and the insurance landscape in the United States. It's a good like rage bait question.
Yeah, exactly. I mean, I get why insurance exists. I get why commercial insurance exists. I get all of it, right? The thing that's frustrating to me as a doctor is there's no, unless I'm missing something off the top of my head, there's no industry where you go and buy something that the price is the price and you don't end up paying the price. I don't understand. Like you go to the grocery store and you buy a head of lettuce and it costs whatever it costs. You don't go and they tell you it's, I don't know how much a head of lettuce costs, $1.99, and you're like, well, I'm just going to give you $1.50, and you just give them that and just walk out the door. It's like, no, this is what it costs. And so it is weird that we have this system in medicine where like for every dollar we charge, we get like 63 cents of it. You know what I mean? It's like, and that 37 cents just disappears and you can't fight for it. You can't ever get it. Insurances will discount everything and they're so humongous and they're worth a fortune. And so I know they have plenty of money. I get we all have to go to work to make money, so they need to make money. I get it, but it's like, how things they can just determine that like hey there's a set cost for something that a clinic establishes or a hospital establishes, we're just going to take whatever the percent is off of it, and that money that is discounted is just gone and you can't fight for it, it just disappears. And I don't know why medicine has established that, because every other place where you go to exchange money, the price is the price and you just pay it and that's just the way it is. But for medicine, for some reason, we've established this rule that it can be discounted and that money has disappeared and it's unobtainable. I don't get that.
Hmm. So that's you think then having maybe some tighter regulations on insurance could make healthcare better.
I mean, I don't know how you do it. So this is lame to say. I don't know how you do that, right? Because sure, you could set some amount where, yeah, I mean, we have our set fee on a mole removal, and if I charge $10,000 for a mole removal and say, hey, then they have insurance, I want 10,000. No, you have to have some kind of regulation to it, but
Yeah.
I don't understand how there's not some fair a number that the providers are okay with based on our skill level. Like, hey, this is worth X number because of only certain number of people can do it without going nuts on the price. And the fees that we have are very reasonable, but just for why that can just be allowed to just not have that money be obtained. I don't get why. And I don't know how you go about it, but every year the reimbursement just goes down and down and down. To
Yeah.
reach a, I mean, it's going to reach a point where some people are like, "Why am I going to become a doctor?" If the reimbursement every year for Medicare just keeps dropping, dropping, dropping. And I get we do it to help people, but I mean, there is a financial incentive to being a doctor, and if it just all just disappears, there's less stressful ways to make money than than being a doctor.
Of course, yes,
Yeah.
100%. Okay, then I know you're a busy guy, you got stuff to do. I always kind of end with like, where do you see yourself in the next 10 to 20 years?
I don't know. So I'm a father of four. I'm happily married, and I am so blessed in that aspect of my life. I'm hopeful my have some grandkids sitting on my lap or something at that stage of life. But for me personally, it would be I envision myself that probably have a few more wrinkles at that time, but that I I've lived a career, I've had a career that thousands and thousands of people have been helped and with their skin that they are better off because they have interacted with me. It has nothing to do with how big my clinic ever gets, it has nothing to do with how much money I ever make. It ultimately comes down to I hope people are happy that I have helped them. And that's all I want, you know what I mean? And so that's my goal. There's no monetary goal I have at all. It's just, I love what I do. I love helping people. It gives me great joy. And I just hope that I can move the clock forward 15, 20 years from now. And it's just been a continuation of that. That's what I want.
Yeah.
Yeah.
All right. Well, thank you so much for coming on, Dr. Burr. I really appreciate it.
Yeah, it's been fun. Appreciate your help, man.